Okay, so besides using the legs, we also use we typically use one of the arms when we're treating any patient, not just diabetic patients, okay? And so, so where do we use the arm if we're treating someone for diabetes? So we already know, let me see if I can move this. We already know that if y'all can, let me move this camera up a little. Actually, let me just zoom out. We already know that the pancreas is right here and the digestive system is right here, right? And so we want to just basically draw a line. So we're drawing a line to the arm, okay? And so that is the area of where the nerves here are going to affect the organs right here, okay? And so we've drawn a line and we know which area we need to put the needles. Now we can be even more specific because we know that we have the large intestine nerve here, the sanjiao nerve here, we have the lung nerve here. We even have the PC nerve down here, right? And so what we typically do in our clinic, we use the same, we use common nerves because they're less painful for the patient. Like PC nerve, if you hit the PC nerve, which is the median nerve, it can cause an electric jolt, which is not so comfortable. So one way is we just stick with the large intestine and the sanjiao and some of the lungs. Okay. On the flip side, what we do is called reverse imaging. So if we were to flip this arm this way, and the arm is up here, and this part of the arm was down here, we would reverse image it. Okay. So reverse imaging it, then the pancreas, the digestive system is also right here too. So we could actually, treat the digestive system right through here. But we could also treat, remember the kidneys are right behind here, right? So we could also treat the kidneys because the large intestine nerves balance or affects the kidney organ. So just by doing large intestine, we could actually hit multiple birds with one stone because we can treat the large intestine, of course, itself. We can treat the small intestine. We can treat the spleen. We can treat the pancreas. We can treat even the liver. So we can treat almost all the digestive organs just by using the large intestine nerve and also in the right locations of the arm. Okay, so we're going to go into here. And these points typically aren't that painful, right? I didn't pay her to not yell, okay? So these points typically are not, the upper arm are actually the less sensitive. The lower arm's a little sensitive, but depending on how you needle, it doesn't have to be. Okay. And really, the QRA is based off of, you can say, we use a lot of needles. You can use less needles, but if you use less needles, every needle you put in, you need to basically create that shock sensation for it to work because the needle is touching the nerve. So if you want to use less needles, you can. You just have to make sure you jiggle the needle around, and you want to induce. In Chinese medicine, we say de qi. Well, what does that really mean in English? De qi in English basically means you need to hit the nerve. And if you hit the nerve, if you use a needle to hit the nerve, they're going to feel a jolt. Okay, it's going to be a jolt, a cramp. They're going to feel that. And so you can use less needles if you get a jolt for every single needle. Okay, I've done that before, and the patients here in Austin don't like it. So that's why we use more needles with less stimulation per needle, and it's a little more comfortable for the patient. Okay, and so that's the large intestine, right? And then you can also do the sanjiao, because the sanjiao also it really doesn't matter because any of these nerves right here, they will treat all the organs here. So you could put it in the PC, you could put it in the heart, you can put it in the Sanjiao small intestine. It really doesn't matter. We just like to use, when patients are lying down or in a, most of the time in our clinic, they're in a recliner, this is what is accessible to us. And so we want them to feel comfortable while they have the needles in their body. So I'm going to do some lung points too. So the lung points basically also treat the large intestine, right? They can treat the large intestine, they can treat the spleen, they can treat the liver, and so it's what I want to emphasize key is in our QRA we basically we're not using necessarily specific acupuncture points. We're using specific parts of the body to stimulate the nervous system at a specific part of the body to elicit a response. The response that we're looking for is we want the signal here to signal the brain, to tell the brain to move the blood circulation to specific organs in the body.